So I would like to welcome you to our 2020 GDA Group Health Plans hosted by your Health Benefits Manager, Christy Biddy. She has had years worth of experience in the health insurance industry. And so I would like to turn it over to Christy now.
Hi, good morning, everyone. We're so happy to have you on our webinar today. We hope we will provide some good information for you, and if you have any questions, we will take those at the end of the webinar, and then you can always call me or email me also. I'm more than happy to answer any questions that you might have, so let's go ahead and get started. As Bay said, I do have quite a bit of experience in the healthcare and dealing with group health insurance. I actually have over 35 years now, so I've seen quite a lot of changes in the industry. So hopefully, like I said before, I can give you some good information on health insurance today. So what we'll cover today is I will tell you really when you're comparing your health plan choices, what you really need to be looking at, and then why choose the GDA, why go with us for your group health insurance. We'll go over the basics of what a health savings account is. We will also cover the 3 GDA 2020 health plans that we are offering for next year. And then lastly, we'll go over how to enroll you or your employees or your family. And just to give you a little bit of information on the healthcare exchange for 2020, right now, Georgia has 4 participating providers in the healthcare exchange. It's Alliant, Ambetter, Blue Cross Blue Shield of Georgia, and Kaiser. Well, for 2020, they all plan to continue to offer coverage, but there are 2 new providers also that have filed plans to join the healthcare exchange in the state of Georgia, one being Oscar Health, which actually I've never heard of before in my entire life, and then the other one is CareSource, which has helped the state of Georgia with their Peach Care plans. The proposed average rate increase has been calculated at this point at 2.4% for Georgia's existing individual market plans. Of course, with the other 2 being brand new, we don't know quite what their rates are going to be yet. The thing to understand about the healthcare exchange, the majority of the plans offered through their coverages, regardless of who the carrier is, the majority of them are HMO plans, meaning you have no out-of-network coverage, and I would say about 99% of them offer narrow networks. And I will go over a little bit further on what exactly a narrow network is. An Urban Institute study predicted that the elimination of the individual mandate penalty at the end of the 2018 plan year, and also the expansion of short-term plans and association health plans would drive up the rates in Georgia to a larger degree than many other states. So as you know, with the beginning of the healthcare exchange, that pretty much eliminated individual health plans in the state of Georgia. You pretty much can't find them. Your choices are usually through the healthcare exchange or through an employer or an association if you belong, but trying to find an individual policy is pretty much gone now. So what is the difference between individual insurance and group health plans? Well, the biggest difference is that a group health plan, you can offer it to your employees. Typically, being part of a group health plan can help leverage lower rates. And also, you do not have to answer health questions or do health screenings that might be necessary when you enroll in an individual plan. Plus, your rates are guaranteed for a year. There's no surprise cancellations or mid-year premium increases. Everything is guaranteed for a full year. Now, on an individual plan, you're rated on everyone that is on your plan. The age is taken into account, the gender, and also where you live, the location. Usually they go by zip code. On a group insurance plan, the cost is shared among everyone on that plan, regardless of age, gender, or health history. So regardless of any of that, regardless of whether you're the dentist or the staff member, the rates are going to be the same for everyone on a particular plan, on a particular tier of coverage. It's not going to vary. So when you're looking at plans and shopping around, the things that you need to look at are the deductibles on the plan and the out-of-pocket maximums. These are two of the most important factors that are going to determine what your premium is. A lower deductible, a lower maximum out-of-pocket is going to mean a higher premium. A higher deductible, a higher maximum out-of-pocket is going to be a lower premium. So basically, the sooner the insurance company has to pay claims on your behalf, the higher your premium is going to be. And just so you know the difference between deductibles and out-of-pocket maximum, a deductible is what generally you have to meet for anything done outside of a doctor's office. Like if you go in the hospital, according to where you have the testing done, but like x-rays, MRIs, CAT scans, anything like that done at the hospital, you're going to have to meet your deductible first. And then after you meet your deductible, your co-insurance will kick in. Usually your co-insurance on most plans are 70 or 80%. That's pretty much the average you're going to find on the plans. Now, an out-of-pocket maximum is all covered expenses that you pay out of your pocket that is not paid by the insurance company counts toward that out-of-pocket maximum. So any co-pays you pay to go to the doctor, your deductible, your co-insurance, including any prescription deductible or prescription co-pays, anything that is a covered expense that you pay out of your pocket is counting toward that out-of-pocket maximum. Once you reach that maximum, all the claims for the remainder of the year would be paid at 100%. Again, co-insurance is what you want to be looking at, which is the amount paid after you've met your deductible. Again, most of the plans are 70 or 80% is pretty common. Primary care and specialist visit copays, how much they are, and if there is a limit on the number of visits that you can have with a copay before going into a deductible and co-insurance situation. That is very common in plans to where they limit you to about 3 or 4 visits with a copay, and then after that you have to meet your deductible and co-insurance. Also, whether it's an open access plan. Open access means you do not need a referral from your primary care doctor to go see a specialist. So you want to be looking at that also. Also, if your plan provides out-of-network coverage. If it's a PPO or POS plan, it will provide out-of-network coverage. If it is an HMO network, they do not provide out-of-network coverage on that. And also, two of the things you're probably going to have to ask for when you're shopping around looking at plans is for them to provide you with their provider network where you can search to be sure that your doctors or hospitals are in network, and then also the drug formulary. So if you're on any type of maintenance drugs, you want to be sure those are covered before enrolling in the plan. Most of the time, those are not provided to you unless you ask, but if you ask, they should be able to give that to you. Both links for our provider network and our drug formularies are on our website at gdaplus.com/health. We have links there, and I'll go over in just a minute exactly how to search on our provider network. We partner with the best-in-class insurance carriers, not just on our health insurance, but on all of the plans that we offer, including our commercial lines and our personal lines. We also leverage our group power. It makes a difference when you're shopping around for plans and when your renewal comes up. If you're a large group or an individual, you do actually have negotiating power when you're a large group. You have attentive staff working solely on your behalf. You will not call in and get put on hold for an hour or two, which I've been told happens when people have to call the insurance carrier themselves. Sometimes one person told me they were actually on hold for 2 hours before they got a rep on the line. So that will not happen here. We have someone available, and if by chance you do have to leave a message, we will call you back just as soon as possible. And our dentists make up our board of directors. They're the ones with the final decisions on everything that we offer through our insurance department. So, they know what dentists need and what they're looking for, and they're the ones making the final decision on these. So why choose the GDA? Why go with our health insurance? Well, we have great plans at very competitive rates. And our team shops around for you. We look at the different carriers, and then we shop around on plans trying to get you the best coverage at the best rates. We also leverage, as I said before, the negotiating power of a group. We do work on your behalf and try and get those rates just as low as possible for you, and we do leverage that with the carriers. Also, your rate is guaranteed for 1 year. We will not have a mid-year increase. We will not have 2 or 3 increases, which someone actually told me they had 2 increases in 1 year, and that will not happen. Your rate is guaranteed from January 1 through December 31st. Also, there are no surprise cancellations. The only reason that we will cancel you is due to non-payment of premium. We will not cancel our plan just in the middle of the year, which other people have told me have actually happened to them. One person even told me they found out their plan was canceled when they were actually at the doctor's office and they went to use their insurance and it had been canceled. They just stopped the plan and the insured didn't even know. They didn't even notify them. So you will not have that with our coverage. There is also no medical enrollment questionnaire. Our form is called an enrollment form, not an application, because once you submit it, you're enrolling in our coverage. Your coverage will be effective January 1st of 2020. There is no underwriting. There is no approval process. There are no health history questions on there. So like I said, once you submit it, your coverage would be effective January 1. There is no age banding. Does not matter how old you are. Again, the rates are the same for everyone across the board. It is a broad network. We do not offer narrow networks on our plans. Our coverage is across the entire state of Georgia, and it actually travels with you outside the state of Georgia and becomes the Anthem PPO network outside the state of Georgia. Now, what is a narrow network? A narrow network generally does not have a lot of specialists in certain areas within their provider network. Primary care doctors you're usually not going to have a problem with, but your specialists, especially in the rural areas, if you need to go see a cardiologist or anything like that, a lot of times to find one in network, you're going to have to travel maybe an hour to 2 hours to find one in network. Also, your specialists, which you really don't get a choice on who you see for those, like radiologists, anesthesiologist, labs, pathologist. A lot of times, most of the time, you don't have a choice on where those are sent. And when you're in a narrow network, a lot of those providers are not going to be in there. So if you go in for surgery, you think your hospital's in network, you think your surgeon's in network, and then all of a sudden you get over $1,000 bill from the anesthesiologist because they are not in your network. So that is the thing to ask about when enrolling in a plan. Is it a narrow or broad network coverage? Also on our network, again, we have a link on our website where you can search to see the providers in network. Once you're on our website, what you need to do when you click on the link is scroll down and search as a guest. You want, regardless of where the provider is, even if it is in another state, say like you want to go to the Mayo Clinic or the Cleveland Clinic. For the state, you would still pull up Georgia because it's asking for you the state that your insurance is offered through. So you would always put Georgia there. The type of coverage that you're looking for is employer-sponsored because it is group health insurance. And then the network you want to look in, and we have this noted on our website, so it will be right there, but the network is the Blue Open Access POS, and then in parentheses, Select Network. So that is what you want to choose when you're searching to be sure your providers are in network. Also, ours are open access plans. You do not need that referral from your primary care doctor to go see a specialist. We offer optional vision coverage. I absolutely recommend it if you're in glasses or contacts because you have in-network, out-of-network coverage. In-network, a lot of them, you have copays, and if you go above a certain amount, say like on a pair of frames or lenses, you get a certain allowance on that. You're only responsible for maybe 20 or 30% of the amount over that allowance. You also have out-of-network coverage, which then it turns into a reimbursement program. For someone who just has single coverage, the premium for the entire year is about $70. And just alone on a pair of glasses with single vision lenses, you can get a $100 reimbursement per year. So it is definitely well worth it if you're in glasses or contacts. Also, automatically included on the primary insured on every single one of our plans is $10,000 of term life insurance. Again, that's automatically included, but it is just on the primary insured and not on the primary insured's dependents. You can also offer this insurance for your employees. You do not have to participate in the plan to offer it to your employees. You can also enroll without offering it to your employees. There is no minimum number of employees that have to participate. We can set up billing however you want. If you're not subsidizing the premium, which you do not have to if you have less than 50 employees, we can send the bill directly to the employee without even going through you. If you do want one bill to come the entire office, say like you are subsidizing the premium, when you get your monthly statement, it will have it broken down by employee on there with the plan that they're on and their monthly premium on there. So it will be broken out every month when you get that monthly statement. But we can handle the billing any way that you would like to do. The thing to know, if you do offer it to your employees, consistency is the key. You cannot pick and choose who you offer it to. If you offer it to one full-time employee, you need to offer it to all full-time employees. If you include your one part-time person, you need to open it up to all part-time people. The reason for this is if you pick and choose who you offer it to, that opens you up to one of your employees filing a discrimination claim with the Department of Labor. So again, consistency across the board if you are opening this up to your employees. And then last but not least, you have a dedicated customer service team. Again, you will not call in, be put on hold for an hour or two. If for some reason you do have to leave a message, we will call you back just as soon as we can, and we're happy to answer any questions that you might have. So just so you know, one of our plans, our high deductible health plan, does qualify for a health savings account. Now, there are two requirements for a plan to qualify for a health savings account. One of them, it has to have a high deductible, which our plan does. And the other one is that you have to meet your deductible before the insurance carrier starts paying claims on your behalf, except for preventive care. So in our high deductible health plan, or any high deductible health plan that qualifies for an HSA besides preventive care, and please note that it has to be coded as preventive from the provider when it is submitted into the insurance company. If it is coded as preventive, it's paid at 100%, no copay, no deductible, anything. Your responsibility on that part is zero. Now, anything other than that, including prescriptions, you do have to meet your deductible before the insurance company will start paying anything. Now, if you go to, say, like you have a sick visit, you haven't met your deductible yet, and you have a sick visit, you go to your primary care doctor. If the primary care doctor is in network, it will get the discount applied to it, but you would be responsible for paying that full discounted amount on this plan. So again, to qualify for a health savings account, you have to be enrolled in a qualifying HDHP plan. You will set up your own HSA account. We do not do that for you. You can choose any institution that you like and say that you're enrolled in our plan, and then you leave us to go to another agent or carrier next year, and it is also a high deductible health plan that qualifies for an HSA. You can keep your same HSA account. You do not need to open a new one. That HSA account is tied to you, not to the carrier who is providing your health insurance. It is pre-tax savings. If it is done via payroll deduction, that payroll deduction can be done pre-tax. If there is no payroll deduction, what you would do is just deposit into your HSA account up to the maximum allowable each year, and then you would take that as a line item deduction actually on your tax return. The thing to note, you can enroll in the high deductible health plan without opening an HSA. That is totally up to you. You do not have to contribute the maximum every year. You can put $5 in or $10, or just you cannot go over the IRS maximum every year. Now, earnings also grow tax-free. You can contribute into a health savings account up to age 65. At age 65, even if you're enrolled in a high deductible health plan, you can no longer contribute to it. Prior to age 65, withdrawals have to be made for approved or qualified health care expenses. Most of the time, your institution will give you a debit card that you can use at your provider and pay directly from that without you having to transfer funds from your HSA account to your regular account. And if you're wanting to see what the qualified health expenses are, you can look those up on the IRS website and just search HSA qualified healthcare expenses, and it will bring up a list and tell you there. Now, at age 65, like I said, you can't contribute to it anymore. But at that time, you can make withdrawals for any reason whatsoever. They no longer have to be made just for health care expenses. It kind of turns into like a mini retirement account where you can start making withdrawals at that time. Funds automatically roll over from one year to the next. You never lose that money. If you put in money every year up until age 65, all that money will be there for you. It will just continue to roll over from year to year. Now, if you switch to a non-qualified plan, if you go back to a traditional health insurance plan, you can still use the funds that are in your account to pay for qualified health care expenses. You can just no longer contribute money to your HSA account. The HSA 2020 contribution limits for an individual is $3,550, and for a family, it is $7,100. And for anyone who will be age 65 by the end of December, at the end of December 2020, you can also do an HSA catch-up contribution in the amount of an additional $1,000. Okay, now we'll go over the 3 plans that we're offering for 2020, and they are pretty much exactly the same with just a few slight changes from our 19 plans. First one is our POS 500. That is going to be the plan with the lowest deductible, lowest maximum out of pocket. The deductible is $500, maximum out of pocket is $6,000. Primary care doctor copay is $25. A specialist copay is $50. And again, there is no limit on any of our plans with how many copay visits you can have, and no referral is required to see a specialist. And also on all 3 of our plans, preventive care, if it's in network, is paid at 100% with no cost to you. Urgent care, there's a $75 copay. Your co-insurance after the deductible is going to be 80%. And on the prescription drugs, there is no separate deductible for those. You just immediately go into a copay situation just based on which tier your drug falls under. And the rates you will see at the bottom of the page, those are the rates without the vision, the rates with the optional vision coverage, and the tiers of coverage that we offer. Our next plan that we offer is our POS 2500 plan. This is by far the most type of common plan that you're going to find out there on the marketplace, and by far this is the plan that we have the most people insured in any of our coverages. So the deductible is $2,500, the co-insurance is 70%, the maximum out of pocket is $7,900, physician primary care copay is $30, specialist copay is $60, again preventive care covered at 100%. Urgent care copay is $75. Again, the co-insurance, once you meet your deductible, is 70%. Now, the thing to note on this plan, it does have a separate prescription deductible. It does not pertain to Tier 1 drugs on here. On a Tier 1 drug on our 2500 plan, it's just a $15 copay. For tiers 2, 3, and 4, you do have to meet that $200 deductible first, and then you would pay the applicable copay listed according to which tier your drug falls under. Again, we have the rates without the vision and the rates with the vision listed at the bottom. Now, the thing to note also, we have all of this posted on our website. And you're more than welcome to go over there and print them out. It's at gdaplus.com/health. And the last plan that we offer is our high deductible health plan, the HDHP plan. And again, it does qualify for a health savings account. The deductible for an individual is $5,000. The co-insurance here, after the deductible is met, is 80%. Individual out-of-pocket maximum is $6,900. You do, again, have to meet your deductible before you go into a copay situation on this one, and it's $30 for a primary care doctor and $60 for a specialist. On this plan, preventive care is covered at 100%. You do not have to meet your deductible. You do not have to pay a copay. Urgent care, after you meet your deductible, is a $60 copay. And on the prescriptions on this plan, you do have to meet your medical deductible of $5,000 before you would go into the copay situation listed based on your tier of drug. But you do have to meet that deductible first. And again, the monthly rates are listed at the bottom. And the thing, again, like I said before, on all three of our plans, all of the money that you pay out of pocket on covered expenses, including your deductibles, your co-insurance, copays, prescription expenses, all of that counts towards your maximum out of pocket. Okay, next is our frequently asked questions on that we get quite a bit. So first, are any plans HSA compatible? Yes, as I stated before, our high deductible health plan is. How can I check to see if my provider is in network? Again, just go to our website at gdaplus.com/health. And you will see, scroll down to the bottom and you will see it find a provider link right there. Again, the network you want to search in, and it's listed on our website also, is the blue Open Access POS, and then in parentheses, select network. And you also always want to use the state of Georgia, regardless of where the provider is located. Does a dentist need to be a GDA member? Yes, they do. The reason being, this is group health insurance, and the group is the GDA membership, so that is why they are required to be a member. Our health insurance is actually the only type of insurance that we offer where the insured has to be a member of the GDA. Now, for anyone other than the dentist to enroll in our plan, they have to be related back to the dentist somehow. So they either have to be covered under the dentist policy as his dependent, spouse or children, his or her dependent is their spouse or children, or they have to be an employee of the dentist. So can the dental practice employees enroll even if the dentist is not enrolled? Absolutely, yes they can, but the dentist has to offer it to the employees. And again, they can't pick and choose. If you open it up to one full-time employee, you need to open it up to all of them. But yes, they can definitely offer it to their employees without enrolling themselves. Is there a minimum number of staff that must enroll? No. We can have just one employee. That's totally fine. That's not a problem. Must a dentist subsidize the premiums? No. As long as they have less than 50 employees, they do not have to subsidize the premium. They can require the employee or the staff member to pay the full amount. Now, the thing is, if you do subsidize it, again, be consistent in the way you do it. If you're paying a certain percentage for one employee or a certain dollar amount, you need to do it for all those employees that are on the coverage. You can't pick and choose and change it employee to employee because, again, you open yourself up to a discrimination claim with the Department of Labor. Must a dentist offer the health plans to the employees? No, the dentist can enroll himself or herself without actually offering it to the employees, but we make it as administratively easy as possible, especially the way that we can handle the billing. So really there is no reason not to offer it to the employees. Actually, it's a good recruiting tool because, like I said before, individual plans are pretty much non-existent in the state of Georgia anymore. So this is a good recruiting tool. Even if you don't subsidize it, you're giving them another option outside the healthcare exchange. And how is billing handled? We generally mail the bills out the monthly bills out sometime between the 20th and the 25th of each month for the following month's premium. And then the payment will be due by the 5th of the month that it covers. So, for example, this month, the statements have just gone out for the month of November, and the payments will be due by November 5th. You can set up a recurring credit card payment, either via credit card or debit card. We're more than happy to do that for you, and those payments process on the 5th of every month that the premium is covering. So like for a November premium, it would process on November 5th. But if that is something once you enroll that you want to get set up, we can definitely do that for you. Again, if you have employees on there and are not paying the premium for them, we can send the bill directly to the employee. Doesn't matter if you have 1 or 5 or 10. We can set up individual bills for all 10 of them if we need to where you don't even have to see it, and then the employee can pay us directly. That does not affect your membership at all. If you're also enrolled in the insurance and you have an employee enrolled in there, and for whatever reason the employee stops paying their premium, doesn't affect your coverage at all. We would just cancel that employee for non-payment of premium. Doesn't have any effect on your coverage or membership whatsoever. We are having our first annual open house for our open enrollment on November 7th and November 8th here at the GDA offices in Sandy Springs. It's from 9 to 4 both days, and you do not need an appointment to come in. You can just stop by. We can answer any health insurance questions you have on our 2020 plans. We can also, if you have other questions, any of the other type of insurance that we offer on the commercial or personal lines, we can help you with that. And one of the things a lot of people don't know is that with the general supervision bill for the hygienists, when it passed, a requirement was that all hygienists have to have their own malpractice policy. And a lot of people, and the hygienists and the dentists, do not know that. But again, if they're operating under general supervision, they do have to have their own malpractice policy. And we can definitely help you out with that also. So dentists, family members, staff, anyone is welcome to stop by on November 7th and 8th. And even if you don't have any questions about the insurance and want to stop by, we would love it. We'd love to get out and actually meet our members and put a face with a name and a voice. So we would absolutely love it if you could come by either, and that's a Thursday and Friday, November 7th and November 8th. One thing to note, our open enrollment does end on November 22nd. We have to end it then so that we can get all the ID cards out and in the mail prior to January 1. So if you do want to enroll, just be sure and get your enrollment in by November 22nd. To also go and look at the information that we've had in the webinar, and also to check our provider network, our vision coverage if you want to look at it in more detail. We also have our summaries of benefits and coverage on all of our plans that goes over in more detail what each plan covers, like how many physical therapy appointments you can go to each year. We also have our life insurance information sheet there posted with the beneficiary form. And again, we have our provider network and our prescription formularies listed there. So visit our website at gdaplus.com/health. We also have the enrollment form listed there. Very simple. Top page, you're going to list who the dentist is, and then you're going to list your information as the primary insured. Second part, you're going to list which plan you want to enroll in, the 500, 2500, or high deductible health plan. If you want the vision coverage, you check that box. If not, leave it blank. And please, a lot of people for some reason skip this part. Please be sure and complete Part 3, that is where you're listing who is actually going to be covered. So you would put your information as the applicant under there with your Social Security number and date of birth. And then also if you're insuring a spouse or any of your children, that is where you would list their information also. And then just sign it and date it. You can return it either via fax to 404-634-6099, or you can email it to me at christy@gadental.org. If you do enroll in our coverage, again, once you submit that enrollment form, no approval process, no underwriting, your coverage would be effective January 1. And again, we're closing in on November 22nd to be sure everyone has their ID card in the mail prior to January 1. You will receive that in the mail to the address you list on your enrollment form, and you should have that sometime between mid to late December. The Premium statements will go out sometime between the 20th and 25th of December with a due date of January 5th. We will also have this webinar posted on the website in a few days, so you can go back if there's anything you missed or that you want to listen to again. We will have it posted there on our website. Now, again, if you have any questions, just let us know. We can answer any questions now, or you can, if you had rather, you can call me or email me. Either one, we're more than happy to answer any questions you have. That's what we're here for. So thank you very much. I hope this was very informative today, and hopefully we will see your enrollment form come in. Thank you.